Hello, my name is Evelyn Metz. My presentation is about improving the care of older veterans through the implementation of an evidence based proven delirium assessment tool, the short form of confusion assessment method, CAMS. Delirium, according to experts, is not a normal manifestation of aging, but rather it is often a manifestation of a seriousness of underlying condition exhibited by sudden change of an individual's mental status, fluctuating in its course of symptoms, accompanied by easily diverted behavior. The elderly, defined as 65 years and older, are rapidly representing a larger population in the United States. The ED, being the point of entry of all hospital care, plays a vital role in the evaluation and management of older population group presenting with altered mental status. As a phenomenon, delirium is often underrecognized, affecting 7% to 10% of elderly patients seeking health care through the emergency department. According to research, at least 57 to 83% of ED providers miss delirium symptoms due to lack of a routine screening tool. Subsequently, a death can occur within 6 months if delirium is not properly addressed in the emergency department. This quality improvement project was implemented at the Emergency Department of Durham VA Medical Center in North Carolina. It is a 27 patient bed capacity. 4 beds are designated for fast track, enclosed 4 beds are designated for patients with psychiatric and mental health issues, while the remaining 19 beds are for emergent and general patient care. The number of veterans seeking health care through the ED is growing steadily. In 2013 alone, 35,000 veterans were seen for various reasons. Before the implementation of the short-term confusion assessment method, it is possible that the older veterans' quality of life, morbidity, and mortality may have been affected. Therefore, implementing the assessment tool was timely and relevant to improve the overall healthcare management of older veterans population. There are two goals in this quality improvement project. One being to improve the quality of life of older veterans seeking care in the AD by adopting an evidence based delirium assessment tool and measuring its effect in the veterans' morbidity and mortality. Second is to reach at least 30% of ED nursing staff efficiently implementing the tool and to demonstrate the financial benefit of utilizing the assessment tool. A sample size of 150 veterans aged 65 years and older were selected randomly from March 11 to June 11, 2015. The inclusion criteria are the following: veterans who are 65 years and older from both genders, ethnic backgrounds, nationality, race, and veterans with known diagnosis of dementia were included. Likewise, veterans who are 64 years old or below, those with severe cognitive impairment, and those with presenting with emergent medical conditions such as TBI, MI, trauma, CVA, and other emergent condition were excluded. The Rasworm Larrabee evidence-based nursing practice model was utilized in the implementation of the confusion assessment in the ED. The model provided the framework to assess, link, synthesize, design, implement, and evaluate, as well as integrate and maintain the practice change to address delirium among the older veterans. Aforementioned, delirium can have substantial effect on the older veterans' mortality and morbidity. The timing to practice change in the ED is therefore timely. CAMS, according to experts, is reliable, sensitive, specific, and convenient in identifying patients with delirium as they seek care to the emergency department. Since its implementation, evidence of positive outcomes in older veterans' care has been noted, such as nurses communicating positive delirium outcomes to the providers and to the receiving units, as well as explaining the role of family members. In its early stage, the importance of implementing delirium assessment to improve the older veterans' care has also been recognized by nursing leadership of the Durham VA. According to previous research and expert analysis, as a valid delirium assessment tool, confusion assessment method has a sensitivity of 94 to 100%, a specificity of 89 to 95%, and a high interratal reliability. Data were collected from electronic medical records in our QI project. They were reviewed multiple times and then logged into the QI audit tool. To confirm the CAMS validity, we assessed the nursing staff's knowledge of delirium before and after training and implementation. In the formal training and education provided, only 42% of nursing staff participated. Others were trained shortly after the implementation start date through providing hands-on confusion assessment method utilization and one-on-one question and answer sessions. We also utilize statistic data to determine our Pearson correlation coefficient. As you can see in this slide, there is a significant correlation in the initial delirium assessment and disposition, as well as moderate correlation that indicated a linear relationship between the ED visit and readmission of veterans. The result of our QI project is explained as follows. Out of 150 veterans selected, 133 of them, or 88.7%, scored negative, while 11.3%, or 17, scored positive. Veterans scoring positive with delirium symptoms have shown new onset altered mental status that is fluctuating in course. Veterans are usually incoherent and or inattentive during interview. 5 veterans who scored delirium positive that were directly discharged from the ED have since returned to their baseline mental status according to chart review. One veteran scoring positive delirium when he visited the ED was directly assisted for a long-term care placement as per family's request. Coordination of placement for this veteran was deferred to his primary care provider. On chart review, these veterans have not returned to the ED within 30 days. There are 11 veterans who scored positive that were admitted mostly to the medical surgical unit. Out of the 11, 3 currently remained in the hospital, 7 were discharged at their baseline status, and 1 passed away 5 days after his hospitalization. It is significant to note, however, that the veteran who passed away came from a long-term care facility. He presented to the ED with severe agitation and altered mental status, of which it was promptly noticed and recognized by the nurse, and communicated it to the provider in charge of his care. 133 veterans who scored negative of delirium, 62% of them, or 82, were discharged, and 38% of them, or 51, were admitted. Of the 38% that were admitted, 16% remained hospitalized, 1 was transferred to a long-term care facility, and 42% were discharged. According to the chart review, 19% who remained in the hospital were showing no evidence of delirium. As shown in this slide, 22 out of 25 staff who participated in the pre and post test stated a level of high confidence in recognizing delirium among the older veterans. This is a significant increase when compared to the 15 out of 25 who previously indicated a level of high confidence. To demonstrate the financial benefit of early delirium management, a case example involving a veteran involved in the selected study will be discussed. The veteran presented to the ED for concerns of complications related to his recent surgery. He was found positive with delirium as the nurse assessed his mental status. The nurse communicated his finding to the provider and to the receiving unit. Within the 24 hours, the veteran's mental status has returned to baseline, averting the average duration of delirium, which is 4 days. As you can see in this slide, the financial saving for the institution is very substantial. The implementation of delirium assessment tool in the ED met moderate resistance, but once the nurses understood its significance, the culture of implementing the tool transferred the way nurses assess the older veterans' mental status. As demonstrated in this project, delirium does have an impact in the quality of life, mortality, and morbidity of older veterans. While limited in quantitative data, the project was able to show the correlation and importance of utilizing CAM-S in the ED. Other benefits are financial impact and the nurse's confidence of early delirium management. Limitations that were considered in this project are the lack of inter-rater among the nurses, the lack of hands-on training of some nurses, and the limited number of female veterans included in the sample. During the first 3 weeks of the project, efforts to correct the limitations included providing one-on-one training for the nurses who missed the training sessions, choosing and training resource nurses from both day and night shifts, encouraging the nurses to reassess the veteran's mental status after it has been done by another nurse, and, whenever possible, immediately discussing the result of CAM-S. Efforts to include female veterans were attempted at great length. However, female veterans presented in the ED during the study time frame period are between the ages of 30 to 35. Our project is able to demonstrate the validity and effectiveness of CAM-S by identifying 11% veterans presented with delirium. Our result is significant when compared to the 7% to 10% data resulted from previous studies. Through this project, delirium awareness has been afforded to the med-surg unit of the Durham VA, veterans, their family members, and caregivers' knowledge and awareness of immediately addressing delirium had also been achieved. However, the success of CAMA's implementation is attributed to the collaborative effort of stakeholders, most importantly, the nurses who spend most of their time with the veterans we serve, valuing their suggestions, validated their role in improving the older veterans' morbidity, mortality, and overall quality of life. As a recommendation, opportunities exist to replicate this project at the community-based outpatient clinics and long-term care or rehab facilities within the VA system. However, a collaborative effort among VA clinicians is fundamental toward improving the older veterans' quality of life and to impact this population's overall quality, mortality, and morbidity rate.